Hello, this is Dr. Tina right here. Thank you for being here with me tonight. I have a short discussion with you. I have a question about the difference between family nurse practitioner and pediatric nurse practitioner. So today with a brief discussion, I'm just going to elaborate on both specialties and talk about it. When we say family nurse practitioner or FNP, is somebody that have gone to school, further their education as advanced registered nurses. Likewise, is pediatric nurse practitioners. So they are all classified as advanced practice nurse practitioner, where they have minimum of masters of nursing practice. And let's dig in. So what at all is the family nurse practitioner? So family nurse practitioner is very broad. Like I said, it's an advanced nurse practice. And so the minimum requirement is masters if you want to obtain a degree as family nurse practitioner. You will go to school for about 2 to 3 years, and some people take longer because they might take it little by little, because that time people will be working as nurses as well as going to school. So they pick classes according to their strength, which is very understandable. And for pediatric nurse practitioner is also advanced nurse practice degree role. That one also go to school for about 2 to 3 years and advanced registered nurse, and they are also nurses as well. But the major difference is that one is concentrated on pediatrics, which are children, and the other is more like a family, so it cut across a lot of ages. So I have a little research here I'll be referring to. And when they say family nurse practitioner, pediatric nurse practitioner, two categories that fall under the larger profession of nurse practitioner. So basically the two of them are a type of nurse practitioner. So like if you watch previous videos I've made, I elaborate on several types of nurse practitioner programs that we have, like mental health nurse practitioner, gerontology nurse practitioner, adult nurse practitioner. We have all these forms, but tonight basically we are talking about family nurse practitioner and pediatric nurse practitioner and their differences. So I would jump to education requirements. Like I already stated, it cut across all the nurse practitioners. So everybody has to be a nurse first. You have to be a registered nurse, for that matter, bachelor's of science holder, before you can proceed to advanced nurse practice. And minimum degree you can obtain is master's. Okay, so master's degree options. So we have several of them, several master's degree options one can go into. One can be family nurse practitioner, one can be pediatric, one can be psych. A lot of them, women, you can name them. Several departments one can hold to practice. But like I said, tonight we are basing on pediatric and family nurse practitioner. So, experience as a family nurse practitioner, a typical curriculum for master's degree with concentration in family nurse practitioner nursing might include family planning, child development, adults and geriatric care, family or lifespan care, family counseling, advanced health and physical assessment, nutrition, health promotion and disease prevention, acute and chronic illness management, dynamics of family health, health policy, advanced pharmacology, and advanced pathophysiology. So when you take their curriculum for the master's program for family nurse practitioner, what I mentioned are included in their education. So for instance, I'm a nurse practitioner, but I specify in family nurse practitioner. So I see mostly all ages, which I can take care of all ages, neonates and upwards. I've seen, the youngest I've seen is a 3-day-old and upwards. So we see all these ages, and mostly we take care of their nutrition, we educate patients, we prescribe medication, We direct patients on stuff that will help them with their health. So mostly nurse practitioner, family nurse practitioner is basically the family from childhood, adults, all ages. So we see all ages. And mostly in our schools, you have to complete pathophysiology and also pharmacology are all included. We do see chronic and acute, and so that is why it's included in their curriculum, because we do take care of chronic patients like people with diabetes, hypertension, and then we do take care of acute sicknesses or acute illnesses, like somebody would come and say, I have UTI, my stomach hurt, all those things. Family practitioner does that. This degree program also enables family nurse students to specialize in certain medical environments or areas. So going to school for your family nurse practitioner can also give one the chance or the opportunity to specialize in some aspects. Like somebody can choose to work as a urologist, pulmonology care, orthopedics care, critical care, long-term care, rehab, surgical or ER or trauma. So as a family nurse practitioner, you have several avenues that you can practice. So you can practice in ER, you can practice in urgent care, you can practice in the family practice, you can practice in primary care. So basically the family nurse practitioner covers a lot of positions. You can practice in so many dimensions or places, and also specialized. Okay, so now pediatric nurse practitioner. So pediatric nurse practitioner also, they have specialized courses for their master's degree. So something like pediatric physical assessment, advanced pediatric clinical assessment, child pathophysiology, pediatric primary care, pediatric emergencies, interpersonal violence and abuse prevention, assessment intervention, advanced pediatric and neonatal pharmacology, fundamentals of comprehensive care, and genetics and genomics. So basically, the pediatric nurse practitioner is focused on pediatrics. They are focused, unlike the family nurse practitioner, where they see all ages and cut across everywhere. This one is concentrated only on pediatrics or children or kids, neonates, all those kind of stuff. So they are more the lower level, like the kids, not adults. So anybody specialized in a pediatric cannot see adult patients. And so if the patient is more than 18 years, you cannot see that patient as a pediatrician, but you can see from. So basically, pediatrics see these children, and some pediatrician see them even the day they are born. And so, but FNP can see kids, children after the third day. And for me, I've seen only from 3 days going. And basically, that's the difference. Money wise, so for nurse practitioners, it's basically different from each state when it comes to salary. So the prices might differ from Texas to compare Texas. Glassdoor says that their salary ranges 98,000 to 140,000, and for the other salary.com says 94,000 to 120,000. So it differs. Even Zip Recruiter says 82,000 to 140,000 per year. ERI Economic Research says is 92,000 to 140,000. So that's how much pediatric nurse practitioners are paid in that range. Now, when it comes to family nurse practitioner, according to salary.com, their salary ranges from 103,270 to 120,900, and the median is around 111,290. So that is for family nurse practitioner based on salary.com. So that is the difference between family nurse practitioner and pediatric nurse practitioner, their salary. And so it differs, and it depends on the place you apply or the place you are offered the position. Or but for now, so that is the difference between a pediatric nurse practitioner and a family nurse practitioner. And the next time we will discuss about what psychiatric mental health nurse practitioner is and compared to other nurse practitioners. Stay blessed. Please subscribe to my channel and hit the like button and share. May God bless you. If you have any question, don't hesitate. Thank you. Bye.